Are you ready to learn? Hi, Dr. Scott Davis, physical therapist, and today we are talking about intersection syndrome. Intersection syndrome is the intersection of the first and the second dorsal compartment of the wrist. There are 4 tendons involved. In the first dorsal compartment, you have the abductor pollicis longus and the extensor pollicis brevis, and they intersect with the second dorsal compartment, which is the extensor carpi radialis longus and brevis tendon. So with repetitive wrist and thumb activities, these tendons can create some friction and develop a tendinitis, tenosynovitis. This is typically an overuse activity. You need to identify what is the inciting activity, try to reduce, modify, or change that activity, and likely, if this is severe enough, you would need some period of rest or immobilization in a wrist and or thumb spica splint to give these tendons a chance to rest and calm down. This is also an area where nonsteroidal anti-inflammatory medications can be helpful if that is tolerated with the GI system. It is also very beneficial sometimes to have a corticosteroid injection in this area. Again, not in the tendons, but in the tendon sheaths. And in very rare instances, would surgical intervention be needed. Usually, if you can modify the activity, create some rest, provide some inflammatory control, this is something that can be treated conservatively. So now you know about intersection syndrome and dorsal wrist pain. Now, you have to be mindful that the differential diagnosis in this area is going to be de Quervain syndrome, so we have to rule that one out. And a lot of times, because de Quervain's is so common or commonly understood, people misdiagnose this with de Quervain's versus intersection syndrome. So now you know a little bit about intersection syndrome. If this was helpful, please like and follow.